Hello, my name is Daniela Verdes and my student ID number is S333271. In today's presentation, I will critically analyze the strengths and limitations of nonverbal communication in health and social care settings, as nonverbal communication is a key aspect in delivering high quality health and social care. It will also analyze how non-verbal communication can influence relationships between practitioners, service users, families, and multidisciplinary teams. It will also evaluate how non-verbal communication can support trust, dignity, and person-centered care. This presentation links nonverbal communication to three key areas: adapting communication to diverse service users, supporting person-centered care, and also improving collaboration within health and social care settings. Most defined nonverbal communication as a whole bundle of messages expressed through facial expression, tone of voice, gestures, posture, messages delivered through body language, personal space. And in health and social care, these cues can reveal pain, anxiety, distress, emotional distress, and discomfort, confusion that may not be expressed verbally. And for example, a patient may state that they feel more comfortable while expressing their pain through facial expression rather than verbally. However, because nonverbal communication cues can be interpreted differently depending on individual or context, practitioners should always combine observations with verbal communication in order to support person-centered care in decision making. Nonverbal communication is important because it helps build trust, dignity, and effective relationships between the practitioner and service users. Through behaviors such as eye contact, attentive posture, and appropriate facial expressions, professionals may show more respect and empathy that may encourage individuals to be more open to discuss their care. For example, when a practitioner sits at the same eye level as the service user and uses eye contact, an open posture, and calm tone of voice, calm facial expression, the service user may feel more respected and more willing to discuss all of their concerns, which leads to a person-centered care. The value of nonverbal communication extends beyond interactions with service users, as it can influence both care planning and multidisciplinary decision making. For example, if a service user who is usually sociable suddenly becomes quiet, avoids eye contact, or refuses activities, it may suggest pain, anxiety, or low mood, or discomfort, or unmet needs. And sharing these observations with multidisciplinary team, it can help them review the care plan and agree on an appropriate support. This suggests that nonverbal communication contributes to person-centered care not only by identifying needs of service users, but also by helping multidisciplinary team make more informed and more coordinated decisions. Nonverbal communication strengthens therapeutic relationships by helping professionals to convey more empathy and reassurance through behaviors such as eye contact, attentive posture, and facial expressions. This is particularly important and effective when individuals find verbal communication difficult. Nonverbal communication should always be adapted to different situations and different individuals. For example, a person living with dementia may respond more positively to a calm tone of voice, to a reassuring body language, than to lengthy verbal explanations, as well as a child living with autism who find verbal communication overwhelming. A significant limitation of nonverbal communication is that the same behavior can be interpreted in different ways, reducing its reliability as a source of information. Another limitation of it is that it may be affected by environmental pressures rather than practitioners' actual intentions. For example, doctors working in a significant time constraint may show limited eye contact or minimal reassuring body language while delivering care to a large amount of service users. As a result, a service user may feel that the doctor is uncaring or uninteresting despite receiving appropriate care. For example, a patient who avoids eye contact may be in pain, may be tired, may be culturally uncomfortable to have eye contact. Therefore, practitioners should remain aware of their non-verbal communication cues and how they can be interpreted, particularly in busy environments. The strengths and limitations identified through this presentation suggest that nonverbal communication cannot be assumed and continuous development is required. Communication trainings can improve practitioners' ability to interpret nonverbal cues more accurately, while greater cultural awareness can reduce the risk of incorrect assumptions. In addition, combining verbal and nonverbal communication allows professionals to verify observations rather than relying on a single source of information. Practitioners can improve practice by using check and clarify approach. For example, they can observe the nonverbal cues. However, they can clarify the situation by calmly asking the service user. For example, I notice that you feel uncomfortable with it, or may I know how you feel about it? This approach would help practitioners to reduce assumptions and support person-centered care. In conclusion, I would like to say that this analysis has demonstrated that nonverbal communication plays a significant role in delivering health and social care by supporting person-centered care and contributing to effective teamwork. However, its effectiveness can be influenced by different factors such as cultural differences, workload, pressures, and potential misunderstandings or misinterpretations. Therefore, nonverbal communication should be viewed as a valuable complement to verbal communication. One of the key lessons I have taken from this analysis is the importance of checking my interpretation of nonverbal cues rather than assuming their meaning. Thank you.